name's Emily. I'll be your CNA today. Can you give me your name?
My name's Tiffany.
Hi, Tiffany. I'm here to take your blood pressure. Is that all right?
That's perfect.
That's great. I'll be using the two-step method today. So I will be inflating the blood pressure cuff, and I'll be looking for your systolic blood pressure, at what point I will deflate the blood pressure cuff, wait about a minute, inflate your blood pressure cuff to around 30 over my estimate of your systolic blood pressure, and then I'll get an exact of your systolic and your diastolic blood pressure. All right? Great. Let me go wash my hands. Now that I've completed washing my hands, my name's Emily. I'm with the North Texas Nursing and Career Institute. Today, I'll be showing an example of getting diastolic and systolic blood pressure using the two-step method. This means I will locate the brachial artery, put the cuff over the artery marker. I will inflate the blood pressure cuff and get an estimate of the systolic blood pressure using the radial pulse, at which point I will get an estimate of the systolic blood pressure, deflate the cuff, wait a minute, and then I will reinflate the cuff after a minute, and I will listen using my stethoscope to find the exact of the systolic and diastolic blood pressure, inflating the cuff to around 30 over my estimated systolic blood pressure. Now let's go ahead and start the process of getting the systolic and diastolic blood pressure. All right, Tiffany, I'm going to go ahead and place the blood pressure cuff over your brachial artery.
Okay.
We're going to locate this. There it is. We'll use your artery marker, and we'll place it 1 inch to 1.5 inches above where your brachial artery is at, ensuring that we have about 1/3 of the cuff still remaining. Is that too tight or is that comfortable
Nope,
for you?
it's perfect.
All right, let me go ahead and make sure that I'm ready to go, and I'll locate your radial pulse. And if you have trouble finding the resident's radial pulse, have them flex their hand and it should be easier to find their pulse. All right, now I've found her radial pulse. I'm going to inflate the cuff very slowly until I can no longer feel her pulse anymore. And 14. I'll release the cuff very slowly. And now I'm going to completely deflate the cuff and give her arm about a minute to rest. All right, I'm going to give your arm a rest for just 1 moment, and then we'll finish getting your blood pressure. Okay, I've got my estimate of my systolic blood pressure, and it's at about 112. So after a moment, while I'm waiting for her to rest, I will then inflate the blood pressure cuff to about 30 over. So I'll inflate it to about 142, 145, or 146. Okay. All right, it's been about a minute, and so now I'm going to use my stethoscope, and I'm going to get a more exact estimate of her systolic and her diastolic blood pressure. And I'm going to place my stethoscope over her brachial artery. I'm trying to make sure you can see it. There you go. And now I'm going to inflate it to about 142. And I'm going to very slowly let it go. Release it. All right, and I've taken her blood pressure, and her blood pressure as of right now is 110 over 58 milligrams of mercury. All right. Thank you, Tiffany. Is there anything else that I can get for you today?
No, that's all.
All right, let me clean up my supplies. I'm gonna go wash my hands. You let me know if you need anything, and you've got your call light right over there within reach.
Will do.
Thank you so much. Now that I've washed my hands, that completes my skill of getting the two-step method of blood pressure.